So welcome, thank you for coming during your clinical day or during your prep day to see this presentation today. So for those of you who don't know me, I'm Tanya. I teach on 5000, and when I did my master's degree a long time ago, my focus was on sepsis. And on our ward on 5000, we've seen, I have to sit down so I get on the video. So we've seen a lot of patients with sepsis over this term. And I know in the 332 class, you have been talking about shock, or you will be in this last week, in the concepts of critical care. So a few months ago, I was on Facebook, which I probably am too many times in a day, and I came across this story from the Canadian Patient Safety Institute. And as I'm looking at the picture of the patient, I'm like, this looks really familiar to me. A comment my 6-year-old son says all the time. But it was the city hospital background and a patient lying in a bed. And I got reading the story, and this is Lani and her mom, Helena. And the story was about Lani in ICU, in my ICU at City Hospital about 10 years ago, and her story about sepsis and her experience with sepsis. And basically the Canadian Patient Safety Institute was trying to tell us that something we've been teaching you in the classes, and that early recognition of sepsis is key in preventing long-term complications. Now, we came up with this concept roughly within the last 10 years, so kind of after Lani's experience. So today, she is here to talk about her experience with sepsis. Now, sepsis is one entity of her whole situation. So she had sepsis 10 years ago. You'd think she should be good now, right? But when I did my master's degree, my work was all looking at quality of life in sepsis survivors. And today is going to give you an inside look at what this disease, so this essential lack of oxygen to her tissues, did to her and how that's affected her now 10 years later. Some other things that you're going to hear from Lani in her story is not just about her experience in ICU and having sepsis and suffering afterwards, but Lani, before she had sepsis, has a chronic disease. She has chronic pancreatitis. Okay, so those of you who are on surgery know, oh yeah, I know all about pancreatitis. I've seen a lot of that. But she's chronic genetic pancreatitis. So she had it when she was younger, and this was discovered later on as her children were diagnosed with the disease. And that put into perspective, oh, this is what this pain is that I've had all along. So because of that, you know with pancreatitis that patients can have a lot of pain. So throughout her life, she's had a lot of chronic pain. Now, what do you see in the hospital in patients who have chronic pain and then have an acute situation that happen on top of that? How are they treated, do you see, in hospital situations? Right? In Lani's experience, when she came in with her sepsis, she was saying, I'm having lots of pain. But they labeled her as drug-seeking because she had this chronic record of having lots of pain. So the tolerance that she had developed for pain control, you know, the little pain meds that they gave her, never really affected her pain. So when she came in saying, there's something wrong with me, they just labeled her and sent her home. So she didn't come back into the hospital until her sepsis was full-blown. Okay, so I want you to take a few things out of this presentation. And one is really to apply the concepts of sepsis and shock and how that lack of perfusion has now affected her life on the long-term spectrum, how an acute illness can have effects to be similar than a chronic disease, how the effects of that chronic disease affects now the rest of her life, but also all the events that happened to her during this stay. I want you to consider, because I know you guys are really strong patient advocates, right? So I want you to take that information and use it every time you see a patient coming in with a concern, right? To individualize them and to treat them all with respect and to value their opinions so that we don't make errors in healthcare, and so that we treat these illnesses and prevent them before they get too serious. So before we start, does anybody have any questions? Okay, I'm going to switch over here then. Who's talking first?
Talk first. I don't care. Doesn't matter.
We'll just turn them both on and then you...
Mine are both on. Okay. I guess I've also had a bleeding disorder too for my whole life, and had really heavy periods, and that was why I had the ablation done, was because I was done having my children, my tubes were tied, and I didn't want to bleed anymore. It was just a lot of pain, and a lot of pain actually. So I went in for the surgery and they said that there wasn't going to really be much pain afterwards, minus like menstrual cramps. Well, I've had horrible menstrual cramps since I was 13 years old, like to the point where I couldn't get out of bed. So I thought, well, can't be that bad. And when I woke up, it was a lot worse than that. And I told them on the floor that it was worse and that there was something wrong. And they didn't listen. And they didn't call the doctor. And they sent me home. So I thought, well, maybe that's normal, you know. I went home for probably, I don't know, maybe 8 hours. I came back to emerge. I couldn't urinate. I couldn't even really walk. Like, I was hunched over in so much pain. And again, the doctor did nothing. He didn't ask really anything. I told him I just had a surgery. Like, there's something wrong. You know, I had had other surgeries. There's something wrong. I know there is. And he said no. Even none of the nurses, like, nobody said anything. The only lady that I can remember was one of the healthcare people that come and stock stuff or put towels and whatever it is into the rooms. And I remember she looked at me and she said, "Are you okay?" And I said, "No, I'm not okay." And she just looked at me like as I was as sick as I was, and that was the only person, nobody else. Now, still to this day, there's no nurse's notes on the night that I was there that I had gone. And he labeled me drug seeking and sent me home, and he gave me pills that would make me urinate. So I went home and laid in my bed, and it was probably 24 hours, and I vomited like buckets. Like, my garbage was probably this big, and like buckets and buckets and buckets of bowel contents for the next 24 hours. And my partner at the time, again, I mean, we didn't know. We just didn't know what was wrong. So I remember he went out to the living room and was watching soccer, and I said, like, I have to go back to the hospital. And I phoned the ambulance, and because I couldn't move, like, I was just dying, and they came and picked me up, and I had no blood pressure in the ambulance. And when I got to emerge, they listened because they didn't have any choice but to. And all that I really remember is the doctor coming in, and he was in his golf outfit, and he said that I might have a colostomy bag when I was done the surgery. And from then, I don't remember anything until probably a week later. And I've just never been the same. I thought, I had had a surgery the year before. They took my gallbladder out. They thought it was to do with my pancreas, and I bounced back from it. I was in the hospital for 6 weeks. I have pancreatitis, and I bounced back from it. I was doing laundry. I have 2 kids that are now 17 and 13, but I could care for them. And I remember getting out of ICU, and I mean, still to this day, just even showering is like the biggest task ever. Like, just doing anything, it's just really, really difficult. I have severe pain throughout my whole body. I feel like I said, I don't know, the best way that I've ever described it is that I feel like I have the worst flu, plus all your muscles are pulled times like a million, like the sickest, excuse me, that you've ever been times a million. I am nauseous all the time. I throw up all the time. My muscles are, like, my body is ruined, like completely ruined. I can't do anything. I've exercised throughout the years because so many doctors will say, no, it's not that, it's because you're laying in bed or this and that. Well, I've raised my kids, like I didn't have a choice. This is 10 years ago, so they were 3 and 7 at the time. I've raised my kids, I've watched other people's kids, I've tried to live. You don't have a choice. Like, I didn't have anybody else to do it for me. So it's just, and now it's gotten worse. My muscles are just wrecked. Like, I don't know, I can't physically do anything. Now I have a torn rotator cuff. It feels like my other one is torn just from doing anything. Like, I was cleaning and I lifted a big bucket, and that's how I tore it. And people, again, they don't believe me. It's like, well, you shouldn't be like that. And I say, well, from the day that I can remember going septic or waking up from being septic, this is how I felt. I can't wear a bra. I can't, to wear it. I can wear it, but it feels like just pain. It feels like it's like knives stabbing into me. Or to wear tight jeans, it feels like just pain everywhere. And my lungs, the bottoms of my lungs were collapsed, and I can't breathe properly, which has been, again, the whole time, and nothing has gotten better. If anything, it's gotten worse, I would say. So again, I wish that the people in day surgery would have listened to what I said. And even when I came back, that's the only answer that people have for pain is pain medication. So, if they could have given me another option, give it to me, but they don't have another option. So sending me home was not the right thing. And really, in the last 10 years, nobody has listened to me about anything. I finally have a good doctor who, he's very good, but I don't even know if he believes that it's, that I'm sick because of going septic, because nobody knows about it.
So it's caused a chronic fatigue and chronic pain syndrome.
Oh, yeah, totally. And fatigue is like I said, like even to shower, like it feels like a workout. I feel like even now, like I used to be able to shower and blow dry my hair, like for example, and put makeup on. Now, like I showered last night, when I have to lay down to wait and blow dry my hair for, an hour later, and then do my makeup this morning, which I don't even do. My arms are so messed up to just everywhere. Like I can't take care of my house, it's affected every part of my life. And I just wish people would have listened. and that I wish that people would still listen. I'm grateful to come here and talk about it.
So what you originally had then was a laser ablation, and accidentally during the surgery then your bowels were cut. So that's what caused the sepsis. So then the bowel contents leaked into her belly, and that's what led to the whole sequelae of events.
Yeah, she burnt like straight through it. And then there was 2 other dusky areas, they said, and they took, however, like just the whole part out because it was all, you know, instead of taking 3 pieces or whatever, because they didn't want the other part to open or whatever. So
they took a large piece out.
yeah. And I guess even after, it didn't stop my periods either. So I remember, the whole reason why I went, I remember the first time I got my period, which was like months after because my body was so messed up. I remember getting it and just sitting on the toilet like bawling my eyes out because I was like, really? Like after all this? And it didn't even do what it was supposed to do, you know? So then I had a hysterectomy a few years ago, and I bled out because of my bleeding disorder. And I swear that I had sepsis again because I had a 12-centimeter abscess and nobody listened to for like 3 or 4 months.
Well, and that is also one of the, when you've been septic, the risk of becoming septic again or getting infections is, the average of that is very big.
Yeah.
So
And
and the more we read about post-sepsis syndrome, any little thing can cause another big infection or for people to go septic. And you know, that and they live in constant fear that any little thing is going to cause another bout of sepsis. And I don't know. I don't think her body could take another bout of sepsis, but
no.
But yeah, the ablation was it was called a microwave ablation, which is a fairly new procedure back then, 10 years ago. And who knows? I mean, accidents happen, and whether it's carelessness or just the luck of the draw, but they said the tool that she was using malfunctioned and didn't warn her. It was supposed to have an alarm when it went through a certain thickness of tissue. So apparently it was not working properly, so she burned right through the uterus, right through the small bowel, and in the one spot was the big part, and then on both sides of the main burn. And because she was in so much pain in day surgery, but they just said, you know, because she has her medication for her pancreatitis, her tolerance is very high, and so they said, oh, you've had lots of medication already. We've already given you this much fentanyl, and, you know, just go to sleep and let it work. But, I mean, she went home and she was still in as much pain as when she'd come out of surgery, but they never did, the nurses never said, you know, maybe something is not quite right. We should call the doctor back and say, you know, maybe we could investigate more, because they told her the pain should not be any more than your normal menstrual cramp pain. So yeah, I mean, and of course, what's the, you get the little care plan saying if you have this and this and this, come back to emerge. Well, she had increased pain, she had, you know, she couldn't pee, her stomach was already distended when she came back to emerge. And she told them that she had had the ablation the day before, and the main focus of the doctor was that he phoned her family doctor
And the pharmacy to
and
see
the
what
pharmacy
meds I was on.
to see how many pills she'd had ordered for her pancreatitis.
And because I had had a surgery a year before
Yes,
that where
right.
they took my gallbladder out, that they didn't need to take my gallbladder
Yeah,
out too.
that's another
But
big
yeah,
story,
I'm
but-
saying like that's another reason why I was also on pain
On
meds
all these
and
pain
because of my
meds, yeah.
pancreatitis. So he didn't phone
He didn't.
anybody that was of any use. And I mean, even all the times that I've had pancreatitis attacks since I was 15, almost every time that I've gone, they've done an ultrasound. You know, like they could have just done a simple ultrasound and they would have seen that my bowel was leaky. You know, like it would have been
Yeah.
a totally different story had they even, again, in day surgery, had they have listened to what I said. And like I said, that's still my issue is people don't listen. Nobody listens to what I say until I'm like pretty
dead.
much dead. And then it's like, oh, you were telling us the truth. Like, why would I come and, you know, why would I waste my own time? And like, I also have urinary tract infections all the time, like constantly. Which again is another thing that every time I read about sepsis, it's like, that's one of the main things. So, you know, which I didn't know about. Like I'm only even learning about lots of things from going septic in the last 2 years. Because, I mean, I knew it was from that because I live it, you know, I knew what it was from. But again, and I've joined a Facebook group too that have gone septic. I think there's only like one other lady in Canada, but there's like maybe 200 and some members, and this is like worldwide. It's not like, you know, there's nobody that you can even talk to that even remotely understands where you're coming from. Like I said, I've lost all my friends because nobody thinks, you know, that you should be sick for that long. I can't go out and do things that normal 35-year-olds or 25 at the time can do. So it's just, there's just so many things that it's affected.
And then you had to raise 2 children on top of all that.
Yeah. Oh yeah. And even more, because I mean, like I said, I wasn't able to work outside my home, so I would take in kids too. Like I've raised lots of kids, and that's what I say. I have done a lot, you know. And like for people to be like, "Oh, well, you haven't worked," it's like that's an insult to me, you know, because I've worked my ass off for one, and everything that I've been through, on top of it, like. Most people couldn't get out of bed and do, you know, like I see people who, or even again on Facebook, for example, which I wasn't on for years, it's like, oh, I have a cold, I've been sick for 3 days now, I just want to die. And it's like, I've been sick for 10 years, like every single day of my life, there's literally not one day that I have felt normal or even remotely close to like, oh, I could go and do this. Like my brain, and that's what I said too, I wish it would have affected my brain because I still am totally in, you know, like I get everything and I want to do things and I look at my house that's a mess and it's like I want to go and do this, but my body can't do it, and it's just frustrating, to put it mildly.
And the thing is we talked about this before, not many people that have lived to tell that story
Yeah.
about sepsis, right? That's why probably the medical profession doesn't believe so much, because 10 years ago, it was unheard of really for people to survive their episodes of sepsis,
Yeah.
of severe sepsis and septic shock. And because 15 years ago, we had that drug called activated protein C that actually prolonged, you probably didn't get it because of your bleeding disorder,
Okay.
but that helped more people survive with sepsis and detecting it early and getting better antibiotics. So now more and more people are surviving with sepsis, and we haven't heard the stories often enough.
Yeah.
Right, so I think it's just amazing that you're here and visible and telling your story, and we should all get shirts that say sepsis.
Thanks. I just had gotten it online, so, and I haven't worn it. I got it a while ago, and I thought about wearing it because, again, I don't really go to many places, and most people are like, yeah, exactly. So I'm like, and then to try and explain it, I'm like, okay.
All the shirts like that here on National Sepsis Day.
That's right.
Yeah, and that too, even having National Sepsis Day, like, it's so,
Yeah.
but it's so nice to just have it be recognized that, like, no, I'm not crazy. This isn't in my head. This is, you know, and I knew that I wasn't. It's not that I didn't think I was crazy, but I know a lot of other people probably thought that I have been. And even that is frustrating, you know, because again, you can't talk to anybody about it that understands at all. Like, and again, it's not like I don't want to talk about it every day. That's not what I want, but I live it every day, so, you know, to be able to just talk to someone that understands, it would be nice, you know. I said, and even on the computer, like, I can't type, I don't even have a computer, so I have my phone, so it's like, you know, I don't want to sit there, like, it hurts, everything hurts, so it's like, even that is like, it's nice to know that other people feel the same, but it would be nice to be able to talk like face to face with someone, or, you know, that has dealt with something similar. So, and hopefully more people are living. Like I said, even that, it was like what did it say? Like every 2 to 3 seconds somebody dies of sepsis, and it's like, it's very serious, you know, and people don't.
And could have totally been avoided.
Yeah.
You know, I think that's the biggest thing. If we had anything to say to upcoming nurses, listen to your patient.
Yeah.
And don't assume that you know what. You know, when I took my nursing, I was told, when a patient says they're in pain, it's not up to you to question whether they're in pain or not. And I see it all the time. There's an instant label on people. Not everybody, and thank goodness that all nurses don't treat their patients like that, but there's a big problem with that. And she's been in the hospital a few times, well, with that big abscess that she had. And it doesn't matter. Every time she goes into the hospital, we face the same thing, that they look at her medications that she's on at home, and they decide when she comes in, they're going to fix her and they're going to wean her off of those medications.
Yeah.
And they take it upon themselves to say, oh, you know, you're taking way too much stuff, so, you know, we're not going to give you that much stuff. Well, number one, you're not going to wean her off of what she takes daily. I can't imagine even what she all had to take just to come here today, to be half comfortable.
Yeah.
And she will suffer for coming here today, because when she does anything, her body is worse by evening or the next day. And we have another appointment tomorrow. But it's still a constant fight. And when you go in the hospital, it's somebody just wants to get her off of all these meds. And we had it not very long ago again, and that is not the answer. Man, if she had the opportunity to get off of every med that she's on, to be pain-free, she'd trade it in an instant.
Yeah.
But there's no post-sepsis treatment, there is no rehab, there's no
anything.
there's no
Nothing.
anything. Like just now, this last year maybe, the last 6 months even, you know, there isn't even a pain clinic now in Saskatoon. We're just finding out a few little things to try again. We've gone to the media. There's really nothing. They say, oh, okay, we discharge you from the hospital. You should be good now. Well, it just isn't that way.
Maybe
And
we
there's
should
no
have
follow-up.
a fundraiser so we can send you to Australia or the UK where they
Yeah.
actually have ICU follow-up clinics.
Yeah.
Well, that's what I said, or even the Mayo Clinic or
Yeah.
something, and even when I say that to my doctor, oh, well, you'd have to fund that yourself. Well, how do I go about doing that? Like how? I don't work. I'm completely unable to work, so how would I go about doing that? And again, to try and tell people about that, I don't know what to, and I don't like asking people for help. I don't like, again, I already feel, I don't know, shitty enough about myself already that I don't want to ask, for anything. But it's like, again, I need help, and it's like there's nothing here at all.
And to add insult to injury, she had just finished her aesthetics course at Marca,
Yeah.
and that's when and right after that, she went for her endometrial ablation. And of course has been ill ever since, and there's nothing. There's no financial compensation. There's no, she doesn't qualify for disability because she's never worked in their terms. So it just is, there's not any area of her life that it hasn't affected and affects, and every year it's worse. Every year her body deteriorates a little bit more. Like this shoulder business is, and nobody has any answers.
Yeah.
Like she said, the doctor said, well, you shouldn't. I mean, you're 35, you shouldn't have. Well, shouldn't.
And having it are two totally different things. Like I have an
you're right.
MRI that
You're right, I
shows that
shouldn't.
it's torn, and it's like, again, just nothing. It's been over 8 months. Like I can't do any, again, and it's just another issue that's added on top of all the other issues already.
Now, is this the muscle injury? Do you think it's related to just being not getting oxygenated during your
100%.
initial sepsis?
Oh,
So
yeah.
now it's just affecting just things you would not expect to be injured, right? Like your muscles.
Ever since I got out,
Yeah.
from the day that I got out of or came home from the hospital, I remember shaving my legs and my whole body would just cramp, and my muscles have been, and I mean, again, I played sports my whole life. I played soccer for years. I played basketball. I played soccer up until I was almost 8 months pregnant with my first kid. I played soccer after I'd had my second kid. It's like I lived a normal life. I did normal things. It's not like I was, just lazing around or doing this or that. Like I did active things, and to try and think could I go do that? Never in a million years could I go and do that, and it's 100% from that. I pull my muscles shaving my legs. I pull my muscles from doing anything. So, and it's 100% from going septic. Again, I didn't feel that way before. I said, I could have went into the hospital. Well, if I wouldn't have been dead, I could have been wearing a bra getting out. I hadn't even walked out the doors or gotten wheeled out the doors, and I had to undo my bra. It felt like, again, plus breathing, plus pain. So it was and again, 10 years later, I feel exactly the same. Yeah, I have a bra on, but it doesn't hold anything up. It's just there because most of you are women, so you know what it's like to not wear a bra. And it's it's not, again, it's uncomfortable. I don't want one here and one here. It's really. So I'll wear a looser bra to have them sitting somewhat normal, It's but it's frustrating, you know, and it's like things like that where people don't, and now I can't even put my bra on. Like my sister had to come in again and help me get dressed before I leave because my shoulders are so messed up. Like I can't literally do anything. Like I feel like a crippled 9-year-old woman, and it's, like I said, gotten worse and worse. And I mean, I had exercised, I even as about a year, and no, probably about 2 years ago, because it's been like quite a while that my shoulders have hurt. I swam, like, you know, I try to stay active because that's what someone does. Well, you just need to exercise. You just need to exercise. No, I don't just need, I mean, I'm not saying that that's not, well, it's not a benefit. I mean, I love walking, you know, I love going for walks, but do I feel better? No, I don't feel better. So it's like, you know, I mean, I'll do it because I like to do it in the summer, but it's like, again, it's not something that helps, you know, like exercise is not the answer to my body pain. Like again, there is no answer. Even all the medication that I'm on, there's nothing helps with the way that my body feels, like nothing at all. So
Have you seen a physiotherapist?
I've seen a couple actually. Him too, like it was
They
like,
can't offer anything either.
no. And everything I did just made it hurt more. Like he's like, well, I think you have a frozen shoulder. Well, again, it shows that I have a torn rotator cuff. Well, I think you have a frozen shoulder. Okay, well, what do you say? You know, it's like, well, I could move my shoulder before I tore my rotator cuff, you know, like, I don't know. It's like, again, and this is fairly recently, or, you know, it's like less than 6 months ago. Like, they don't listen. Like, so, I don't know. Yeah, I have literally seen so many people, and there's just nobody has any answers. So yeah.
It's a master's project for somebody.
Yeah, that would be awesome.
Faculty person to work with. Do you guys have any questions?
So in the UK and Australia, what sort of programs are there? Is it for sepsis or it's just post-ICU?
There's both.
There's protocols now that they have set up, I think. Very early antibiotic therapy is one of the big things that they're doing.
Yeah, I've heard that, or like even on Facebook.
There's an actual there's a sepsis kit apparently in the ICUs now.
So that's for the early detection of
Yeah.
sepsis, to prevent
Yeah.
sepsis from happening. The question you're
After.
asking, Sonia, is in the UK and Australia, 10 years ago, they have two roles. They have an ICU liaison nurse, which is a nurse that works with patients as they move from ICU to the wards to help their transition to care for their psychosocial needs that they may still have. And there are ICU follow-up clinics where it's not like going to your GP, but it's after any critical illness. And when you get discharged from the hospital, they will follow you up for several years. And it's a multidisciplinary facility that has nurses, doctors, social workers, physio, occupational health, and something else. And they work together to provide those holistic post-illness needs. But they never, ever came around this way. Not well received, unfortunately.
And I don't even know about things there. You know, I just have heard about the Mayo Clinic through other people, and, you know, that, like, I don't even know about lots of things.
Just scratching the surface.
Yeah, really, yeah. Yeah.
Or a good public health or community health rotation for next year. Maybe we should make up a group and work with you.
Yeah.
We'll see. It's a good question. Anybody else have questions? I have lots of your rooms.
Yeah. After the one surgery where there was the accident and they perforated your bowel, were you, do you know if there was any like alert system? Like, was everyone aware that this had happened and that it could lead to sepsis, or was there no?
Well, after I came out of everything, I've heard, because I've said, you know, like, well, I didn't know that you're burning your bowel, like you're having your bowel burnt was even, I didn't know what it was before I went in, but everyone's like, well, that was a risk. Well, if that was a risk, why did nobody check it? You know, like nobody checked any, like literally nobody listened, nothing. It was like exactly what she said. No, you've had enough pain medications, go to sleep. I told anybody who would listen, like, I'm in severe pain. And usually I just say, something's really wrong. Like, I don't know what's wrong, but I don't feel good. I feel like I'm dying is usually what I say, because I usually am when I'm at that point, like really, you know, and it's like, again, nobody listened. Even when I went back to the ER, nothing. He phoned the pharmacy and that was it. The nurses didn't come in, give me anything. Like, even when I go in for a pancreas attack, they start an IV and give me pain meds, you know, like that's like the first thing that they do. They didn't start an IV, they didn't do anything. I think that the nurses came into the room one time and I was there for hours and hours and hours, like hours.
And he didn't consult the gynecologist who had done the surgery. Yeah, he didn't suggest anything, not an ultrasound, but an ultrasound already would have shown that it was leaking because her tummy was already distended.
Yeah.
You know, it certainly hadn't gotten into the sepsis yet, but 24 hours later, it certainly had.
Yeah.
Because she had a point at the next day around noon, I think you said, where she said she just had this stabbing pain, which is probably when it broke open, because they thought is the microwave probably, when it burned through, you know how a burn is, it kind of gets a scab, cauterized it basically, and then after a while the moisture softened it and it broke open. Of course, when she went back by ambulance the next day, they paid attention and said, oh, okay, I guess we should check this out. Well, didn't take very long to realize that there was a major problem.
Yeah.
But no, nobody really seemed to click in that, yeah, she had this surgery, and yes, that is the #1 risk of that surgery.
Is there any action that you can take against the company for the equipment failure, the region,
No.
is there, I'm sure you've done all that, but I'm just wondering, what have you done? That's my one question.
Yeah.
And my second part is, do you do much public speaking about this, or is this is brand new, right?
Yeah.
So, Helena, I don't know if you remember me.
Yeah, I do.
Yeah, okay. So, what about, I'm listening to you, and I can see all this playing out because I know the unit that this all occurred on,
Yeah.
of course. Would you be open to going back to that unit on an ed day?
Love to.
So they have a perception?
Yeah.
Because I'm in recovery room there now, and the whole pain management, like everything that you're saying, occurs.
Yeah.
Still occurs.
Yeah.
Yeah.
So I think it would be a huge benefit if I could forward your name onto the educator there.
Absolutely.
And because it may be a good eye-opener for them, that yes, you need to go back and assess, and yes, the pain, and like the medications, all of that.
Yeah.
I think would be really good for them to hear, and just to hear your story because it happened there.
Yeah.
Yeah. Yeah, absolutely. I said the only every time I talk about it, I bawl my eyes out. So that's really, you know, I said this, it ruined my life. It's not something that is easy to talk about, but I'll definitely, again, just nobody's ever wanted to listen. Like, you know, everyone's like, oh yeah, and most people, again, they don't know what it is. They're like, okay, so, and nobody, but absolutely, I would definitely.
We have tried to, we started a lawsuit.
Yeah.
We don't have $1 million.
Yeah.
You know, we couldn't even get an expert witness in the doctors from Saskatchewan. They would not, there wasn't one doctor that would speak against another doctor in this province. We had to get an expert witness from Alberta to say, you know, you have to prove, of course, number one, that there was negligence. Number two, that period of her being sent home from Emerge the first time to coming back to Emerge the second time. Well, how can you prove that's why she went septic? Well,
now everywhere that you read now, it's like every hour counts. So it's like, well, there you go. I don't even have to say anything. It was 48 hours. If you would have listened to me, I told you within the first half an hour of waking up. So if you would have listened when I first told you, it says everywhere that I read, every hour counts. That's like the first thing that I see now, and it's like, I wish that they would have known that then, or, so again, this was 10 years ago when we tried, and then...
You just don't have the money, and you don't,
Well, and I don't know how long it would be.
No. It just was sort of a dead end for us at that time, and it's probably too late to pursue anything. We did actually go not too long ago again. There were some pro bono lawyers that they advised us to go see. Our MLA told us that, but again, she doesn't qualify because her husband, they just live just above the poverty line. So, you make too much money, so you don't qualify for anything, even though she doesn't qualify for any kind of financial assistance of any kind. So it's been a pretty frustrating ride. But boy, we'd love to make people aware.
Yeah, definitely. Yeah.
Did you ever receive an apology of any sort from anybody that was working? Did anybody acknowledge what happened?
That's funny that you say that, because just recently my mom had written to, what is it called? The internal, when they do an internal investigation or whatever.
For the
and
physicians,
it was a long time ago that she did it, and he didn't say anything then. He said, well, she got up and went. It was the playoffs. It was the first year that I had actually liked hockey, and Calgary was in it. I just remember because it was before I was totally out of it. And I walked out to the waiting room for like 3 minutes, and then I turned around and went back into the bedroom. He's like, well, she walked out to the waiting room and was watching hockey. Well, yeah, I was like, I can barely even read the things. Like, it just infuriates me. And then we wrote again, and he says, yeah, he should have been more, what was the word? He should have listened better, and he's very sorry that I've had to live my life the way that it's been, but there's really nothing that he can do, and that too, it's like, I feel useless enough already, but to not ever be able to make a living, to not ever have anything, it's just, that's a whole other aspect of it too. And yeah, you can say you're sorry, but it doesn't change anything in my life, that's a whole other, there's a lot of things. But yeah, so I think he kind of said he was sorry, but and that, from now on he'll start paying better attention, yes, he should have listened better. Well,
and the surgeon who did the ablation, she also, if you read them, it's like a form letter. We're sorry this happened to you, not I'm sorry I did this to you. We're sorry this happened to you. We hope that this is going to bring closure to your whatever. Well, there's no closure to this, unfortunately. So I guess lip service, but certainly no, And we haven't ever gotten to the nurses. I've often wanted to go to health records and see who the nurses were on at in-day surgery and in ER. There's only so many hours in the day and so much energy. But no, we haven't actually gone. But that would be really, really good to do.
I hope sharing your story is therapeutic for you, and hopefully by us sharing with these guys today, we can influence the way that they practice their nursing.
Yeah.
Absolutely.
And maybe through word of mouth, we can get further and further.
For sure.
Absolutely.
Yeah.
We appreciate your time.
Yeah, definitely.
It
Definitely.
brings me to another theme that I always teach these guys, and it's the concept of anticipation. And anticipating those things that can go wrong with your patients and preventing them or detecting them early. I think my group, I say that every week, don't I? Right? And this just proves how important that whole concept is. So I thank you very much. I know it was a lot of hard work for you to come.
No, I'm glad
today
to
see
come.
us.
And
At least you got a ride, you didn't have to park.
yeah, that was a bonus. Yeah, and I didn't have to drive either, so that was even better. Yeah.
And if you guys have any other questions, please feel free, or you can come up and talk to us now. So we'll end the formal presentation, but we'll still stay here and field questions for you if you'd like. And those of you who do have to get back to clinical, go ahead. But thank you for coming.
Yeah, thank you very much for your time.